It's Monday, April 4th, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to look at a study entitled Ozone Therapy in Veterinary Medicine. It's more like a review. It comes to us from Romania, from our friend, Dr. Calin. And he has done a great job summarizing some of the ways in which ozone therapy is used in veterinary medicine and how it works. So let's take a look at what he has to say. And thank you, Dr. Calin, for your contributions to ozone therapy in veterinary medicine. So due to its reactivity and instability, it can inactivate microorganisms, stimulate the tissue level oxygen metabolism, and be efficient in muscular and cutaneous lesion treatment, anti-inflammatory effect by oxidizing some pro-inflammatory mediators, analgesic efficiency by oxidizing some pain mediators, and regenerative properties by releasing platelet-level specific growth factors. I just throwing this out there. I listened to a lunch meeting by Dr. Al Nunez where he was talking about also heat shock protein 70 and ozone's ability to help increase voltage in the body to a point where you have a much healthier animal. That's not something really touched on in most of the literature available, but it's something to think about. Let's keep going with this, though. This point is important. Even though known beneficial effects of ozone in medicine are published, the idea of toxicity is still promoted without any solid proof. Really true. No solid proof for the FDA stance on ozone therapy. And it's just sad to see that still lingers. So a lot of really cool things. Stimulation of oxygen metabolism. The general effect is similar to post-physical training feeling. Dr. Judith Shoemaker says she compares ozone therapy to exercise in a syringe without doing joint damage. So some of the benefits you get from exercising, like I just played basketball this morning, I do feel better. And there's some benefits that I get circulation wise and oxygen level wise and just overall health because of how that affects the biology of my body that you can realize just by doing ozone therapy. So ultimately, the controlled increase of oxidative stress finally has, as a result, an increase of the antioxidant system. And we're not going to go through all of the different things that Dr. Calin talks about in this study, but I think he did an excellent job in summarizing the mechanism of action. And they're varied. There's lots of nuanced areas in which ozone is acting that you that we're still learning, we're still trying to understand, but that are apparent. Immunological action of ozone in the blood is focused on monocyte and lymphocytes, which release small quantities of cytokines. So we can have actually a modulation of the immune system through cytokine manipulation by ozone therapy. So he actually references the Madrid Declaration, which we've just got done going through, and how where that says we should use ozone therapy and how we should administer it. Lots of different ways, of course, to do that. Here's an interesting thing. Analgesic effects, which we don't talk about a whole lot. I don't talk about, of ozone rectally insufflated or injected into trigger points in dogs has been proved. And so I think that's an important point. We can use ozone even maybe in trigger points or acupuncture points to decrease inflammation and to decrease pain levels. There's lots of ways, of course, reproductive uses of ozone. We've touched on those in the past, so I won't go into that. And then he says this: infectious diseases, immunosuppressive diseases, ischemic conditions, degenerative diseases related to aging, acute or chronic joint pathology, including discal herniation, diabetic ulcers, with regenerative purposes in muscular tendinous lesions of athletes and in wounds of many categories. One area, again, is performance horses to increase, and that's down at the bottom here, the biochemical status of horse blood following ozone therapy has been proven. So many neat ways in which we're using it. And thank you again, Dr. Calin, for this research that you're doing. This has been 5 Minutes of Proof. We'll see you next week.